Okay, Ken, now you run the leading clinic in this area. How many kids do you see in a year, would you say?
We see about 45 to 50 children and adolescents per year.
What age group are we talking with?
We see kids anywhere from age 36 months up to age 20.
So 3 years to 20 years. Okay, and what is treatment? What does that look like?
Well, treatment for children can take many different approaches, and we always work with families in terms of making decisions about what they would like for their kid. And I would say that at the center of our therapeutic approach is that we want to explore with children and families what's the best way to help a child feel good about himself or herself. I would say that most of the parents that we see are very worried that their child isn't happy in terms of who they are. And so the central task is to try to explore with a child how they do feel about themselves. And I think that our approach is very subjective. And so, for example, with young kids, just to concentrate on that age group, gender, as I said earlier, is a very subjective, meaning-making part of development. The children are trying to figure out what does it mean to be a boy or a girl. And so, for example, when we see children in play psychotherapy or work with parents, we certainly try to explore with kids what their understanding is of gender. And one of the fascinating things about working with young kids is that they often do have very rigid notions of what it means to be a boy or to be a girl.
So is that what you work with?
Sure.
Now,
so we might look at, for example, children's reasoning and thinking. So some 4 or 5-year-olds might say, I like trucks, therefore I must be a boy.
Right. Now, I've read in some of the research that I was provided that one of the things you might do is if a boy is always playing with girls' toys, to advise the parents to take away those toys for a while and have the child play with toys that are more appropriate for boys.
Well, I would say that our approach, when we're dealing with surface behaviors, let's say a little boy wants to go to kindergarten in a dress. One of the issues we discuss with parents is if your goal is to help your child feel better about being a boy, and if he thinks that putting on a dress turns him into a girl, then we have to talk to the child at the cognitive level that putting on a dress doesn't really make you a girl. You might be pretending to be a girl. And again, thinking about ways of broadening their understanding of what these surface behaviors mean.
All right. Well, what happens, though, if you just let a child be? Why not just let them go to school in a dress?
Well, I think the why not question is related to the more general issue of how does gender identity evolve over time. As you talked about, there might be gender flexibility with development. And so we're talking about developmental trajectories. One of the things that we've learned over many years of following up young children in our clinic who appear to be really struggling with their gender identity is that most of them grow up and wind up feeling okay about their gender in relation to their birth sex. So they don't continue along a path that results, by the time they hit adolescence, with feeling a real disjunction between their gender and their somatic sex, and they don't continue down a transgendered path. So far in our follow-up studies, most of the kids who are struggling with gender issues, yeah, between 80 to 90%. no longer struggle when they're older.
Herschel?